Welcome and thanks for joining this CCD's round, the first of our year this year, which is actually the 12th edition of our knowledge sharing series on public health interventions. My name is Joe Jewell and I recently joined as the Global Director for the Cities Changing Diabetes programme. Cities Changing Diabetes works to address urban diabetes and obesity, with a particular focus on vulnerable communities. The partnership has grown since 2014 and we're now working with more than 40 cities around the world. At Cities Changing Diabetes, we are constantly looking to learn from and draw from existing experience around the world where cities are pushing innovative and impactful work on public health. And today I'm pleased that we can share insights from the Netherlands, which has a long history of working with communities on health promotion. I'm delighted to introduce Patty Scholten, who is the Programme Manager for JOGG in the Netherlands and responsible for JOGG's international collaborations. Patty will present how JOGG is reshaping environments for young people using a community-based approach to reduce health inequalities. For more than a decade, JOGG has orchestrated multi-stakeholder initiatives in more than 200 municipalities in the Netherlands. Patty will present for 25 minutes or so, and then we will go to a Q&A session where you'll have a chance to participate actively and ask the questions that you've been thinking about. Please look for the question mark in the right side of your screen, and you can enter your questions during the presentation so that when we come to the Q&A session, we will have the opportunity to discuss your questions and I will manage the discussion on your behalf. But first, let us hear from our speaker, Patty Scholten. Patty, the floor is yours.
Thank you, and thank you for having me. I'm presenting JOGG, and JOGG is working towards a lifestyle transition from unhealthy to healthy because we believe a healthy future starts with a healthy youth. And for now, I want to ask if you can provide the slides, please. You can go to the next slide and another slide further. Please, the next slide. Yes, thank you so much. Okay, first of all, imagine you are walking down the streets of a city you often visit. Imagine what kind of stores and shops do you pass? And is it easy for you to buy fresh food, to buy healthy food? And I think even when you are not hungry, it's very hard to resist all the promotions you come across and fight back against the food smells that are causing you your cravings. And do you know we make on average about 200 food choices per day? Many of these choices are unconsciously and are influenced by our environmental factors. So what's going on? Our built environment has changed considerably, very much in the recent decades, all around us. We are constantly bombarded with messages tempting us. And we buy a lot of unhealthy food because of this, and we are less active because of this. We suffer from stress and we do not get enough sleep. And this behavior is actually also reinforced by the constant use of smartphones and tablets. So then we can go to the next slide, and then we see that our youth is growing up in an obesogenic environment. And the way our environment is designed and how people live makes it very hard to make the healthy choice. Some groups of children are more affected than others, but 1 in 10 children is living with overweight or obesity, as indicated by the World Health Organization. This is a very complex challenge, and it is clear that actions only aimed at the individual alone are not enough. Next slide, please. And it's not enough because as a result of our obesogenic environment, we see more and more people living with overweight and obesity. We see that being overweight gives a greater risk of, among others, diabetes type 2, high blood pressure, cardiovascular disease. And in the Netherlands, the healthcare costs will have doubled by 2040. This is something we have to do something on. And next slide, please. I want to give you some other facts and figures. Because in the Netherlands, almost 16% of youngsters are living with overweight, and people with a lower level of education live 4 years fewer and report poorer self-perceived health 14 years earlier. And if you estimate the expense per child due to obesity over the entire life course, it's €150,000. Next slide, please. We believe at JOGG that every child has the right to grow up healthy. So grow up in an environment which makes the healthy choice the easy choice. And JOGG sees itself as a knowledge partner in this complex challenge. Next slide, please. We are the knowledge partner for a holistic or system approach and integral cooperation. Next slide, please. And this is why we work nationally, locally with the JOGG approach. And our approach is a holistic approach based on the principle of health in all policies. I will elaborate on this later on, which is rolled out in JOGG municipalities at 3 levels: at a policy level, so local government, at executive level, so targeting professionals, and at neighborhood level, targeting the residents. And in order to make those places healthier, where children and adolescents spend most of the times, we target different environments. Like we go to schools, we go to neighborhoods, we go to sport clubs, and we also have activities on social media, of course. Next slide, please. Having said this is a big weight to carry, and you should not only carry this on the shoulders of health professionals. No, to create a healthier society, everyone needs to be involved. As this slide illustrates, all policymakers, all professionals from industries, from all kind of different sectors, everyone needs to be involved, nationally and internationally. And when we go to the next slide, you can see that we do this together with a broad network of more than 200 Dutch municipalities, 212 at the moment. And this is including the Caribbean Netherlands. And we aim to ensure that all children in every municipality can grow up in a healthy environment. And if you go to the next slide, you see that we do that not only with our JOGG municipalities, but that there are a lot of other different parties involved in our WorkNet. And maybe this is a new terminology for you, but we call this a WorkNet because the parties are not only connected to each other, but they really do make a concrete change, and they work in policy and practice to make the environment healthy. And the next slide, how does the JOGG approach work? You can immediately go to the next one, because with our approach, we provide the basis for integral cooperation. And this starts with a local team that takes control and look beyond domains. And this one is very interesting. A JOGG municipality forms a team made up of a JOGG coordinator and a JOGG policy advisor from the municipality. This team receives support from our national JOGG organization. And maybe good to know that the Mulier Institute, it's a Dutch knowledge institute, they conducted research on the competences of a JOGG coordinator, and he or she fulfills multiple roles. So he or she must be a coordinator, must be a networker, must be a facilitator, sometimes even a politician in their way of working. And this person also needs to have a helicopter view, must be a go-getter and also an entrepreneur, and must communicate at all different levels, from a professional level to policy level, and sometimes even with the community, into the community. This is a team that brings people together, and as you can see on the next slide, this team builds a local WorkNet. So the task of this local WorkNet is to make the environment more healthy, but operating from within the community. So this, as you can see on the picture, this local WorkNet consists of professionals from all different domains. So from education, you can see professionals from sport, from welfare, from spatial planning. And if we go to the next slide, all those people together work on 6 essential conditions. We call this the basic conditions. And these conditions need to be met to provide a kind of basis to get started. I will go through them quickly so that you have a rough overview of them. So the first one is political support. You need a mayor, an alderman, and council members that are committed ambassadors of your approach. And they can ensure that a healthy environment and lifestyle are on the agenda, on the political agenda, and integrated in all policies. They can live the health in all policies, from care to spatial planning and from sports to economic affairs, for example. The second one, public-private partnerships. A healthy childhood is a shared social responsibility. So you actually can only achieve a healthy environment if all parties are involved, just as I illustrated on one of the slides before. And our business community or the commercial community has a major impact on the living environment. So having public-private partnerships can create something unique. The third one, shared ownership. If we talk about shared ownership, it's about asking what people themselves want to change in their daily lives. And that's crucial when it comes to creating a healthy environment. They know better than anyone what barriers or opportunities there are. And on the other hand, shared ownership also assumes that the work net we just talked about take responsibility themselves too. We go to the fourth one, connection between prevention and care. We believe that every child has the right to grow up healthy. So do also children who already live with overweight or obesity. So later in the presentation, I will elaborate on this condition further. The fifth, monitoring and evaluation. The JOGG approach is a tailor-made approach. So a solution that works well for the one municipality may maybe not work in another case. So it's essential that JOGG municipalities monitor and evaluate their approach. In this way, we make it possible to adjust and share valuable insights. And the last one, communication. Last but not least, communication is essential because it makes the activities of the JOGG teams visible and transparent, and thereby also ensuring more support among stakeholders. Having said this, we can go to the next slide. This slide shows a model, and this model shows an overview, including the child in the middle, including the various environments of the child, the basic conditions, the work net, and the teams we focus on. So drinking water, eating healthy food, being physically active, and sleeping well. And then we can go to the next slide. I will tell you something more about the support that JOGG offers. And we do this on different levels. We do this on a national level. So we have a very good relationship with the national government. We are here in The Hague. That's also where our national government is. And part of this good relationship is that we are funded by the Ministry of Health. And we play an important role in the Dutch National Prevention Agreement. A second thing is that we invest in public-private partnerships on a national level. So in these partnerships, we ensure that parties work on making changes in their own core business. And as an example, you can think of supermarkets. Another thing is that we arrange covenants or agreements on a national level. Like an agreement we have with more than 40 parties, from caterers to producers to wholesalers, all working together on making healthy food available in schools. And the last one, we bring the outside in. And we work with a special team on innovation, which also helps our local teams. Coming to the local teams, our JOGG municipalities are offered different types of support. And we divided it in 4 different kinds. So sharing knowledge online, and you can think of meetings, trainings, coaches, experts, but we also share knowledge online. So JOGG facilitates and shares knowledge and skills via a platform. It calls My JOGG. We have a newsletter, and we organize online training courses and meetings. Then we offer support on publicity and lobbying. So we create a shared awareness, and we are putting healthy society and healthy health in all policies on the agenda. And we provide tools and materials. So we make various online and offline tools and materials available, also via MyJog. And this is you can think of checklists, guides, templates, e-learnings. So there's a lot we can do to support the teams. And now I want to give you 2 examples of what we achieve with the JOGG approach. And the first one is a healthier range of food offered in the sports environment, community centers, schools, theme parks, and playgrounds. And we call this method JOGG Team Fit. And in this method, managers and volunteers of those locations, so it can be a school, can be a theme park, can be a sport club, they can ask free support from JOGG Team Fit coaches. And the coaches, they advise the locations, and they bring tools and inspiration to make every step towards a healthy food offer in the canteen simple and fun, because it must be fun as well. And in the Netherlands, we always use the guidelines of the Netherlands Nutrition Center for this. And besides giving advice on the food offers in the locations, we also look at the school setting in the vicinity of schools. So we give advice how to work with food providers around the schools, and we are looking for opportunities in policy on municipality level. And in this point, I want to stress one last thing, that this process not only requires effort at a local level, so for example on a school level, but also on a national level. So we as JOGG, we also join discussions with the caterers, as I just told you, but also with food, fast-moving consumer goods industry or quick service restaurants. And the next example I want to give you is child to a healthier weight. There are children living with overweight and obesity, and often they need more support than our prevention approach provides. And that's the reason why we introduced as I call it, a program, Child to a Healthier Weight, which is based on scientific evidence. And nowadays in the Netherlands, 14 municipalities are working with this program. And this slide illustrates the 6 steps of the program. And it provides the basis for a local integrated care based on the knowledge that overweight is multifactorial. So overweight is caused by an interaction of biological, physiological, and our environmental factors. And in practice, we often go from step 1, the detection of overweight, to step 5, getting started. And this program, Child to a Healthier Weight, elaborates on what's really happening within the family. So there is one key figure for the family. It's the central healthcare professional or the central coordinator. And this professional is the connection between the different partners who may be already involved in supporting the family and the connection between the family itself. And they are working towards a situation in which the parent and child increasingly become autonomous in working on a healthy lifestyle. And I think this is very important, so that it's also a sustainable approach. we go to the next slide and we talk a bit more about what we achieve with our approach, because we are very proud of these numbers. Potentially, we are reaching 1.6 million Dutch children and adolescents. And a study of Kobus et al. Shows that implementing the JOGG approach gives a reduction in the number of overweight people. And in neighborhoods where the JOGG approach has already been operating for 4 years, the measured percentage of overweight children and adolescents was 9% lower than in neighborhoods without the JOGG approach. And it's actually good to say that the JOGG approach seemed to be successful, most notably in areas with a low socioeconomic status. And we believe sometimes you need to make a difference to make the difference. So this is something we are also proud of. Next to that, the OECD, the Organization for Economic Cooperation and Development, reported also about JOGG as a very good practice, because they said the JOGG approach is preventing people from becoming overweight and thus also preventing related diseases such as diabetes. And our approach saves 2.72 euros in healthcare costs per person per year. And in addition, it adds 16 more years of life and 19 more years of a healthy life on average per 100,000 of the population per year. And along with this, a greater labor market participation and productivity. So it's very good that the OECD also acknowledges this. Then we can go to the last part of this presentation, future and call to action. First of all, the future, come rain, come shine. Looking into the future, JOGG wants to grow further in the number of municipalities. And next to grow, we want to be the knowledge partner for our municipalities. And we want to support every municipality efficiently and impactfully. So we are there, and we are also looking at expanding to other themes, such as, for example, mental health. And one of the spearheads still is cross-domain work. So not only on a local level, but also on a national level and on an international level. And to conclude, as a final point, I would like to bring to your attention our new e-learning. So that's our call to action. The Maastricht University and JOGG, we joined forces, and we can offer you free e-learning. It's a 4-hour course aimed to teach you to set up a local community-based approach. And the course is self-paced, so you can follow it at any time you want. And each chapter includes assignments, so you can actively working on this and thinking how you can apply it in your own situation. And after you have completed the course, you will receive a certificate of participation. So if you want to work on the lifestyle transition, please I think Joe will show you an email address, and please let your email address over there and you will receive your personal login code.
Thank you so much, Patty. That was a really, really informative presentation, and you saved us 1 minute of time as well. So we have 1 minute extra time for questions and answers in our session. And really, I mean, the presentation was an excellent overview of the JOGG approach, and it's really impressive numbers that you're able to communicate. I mean, not only that you're reaching more than 200 municipalities, reaching a huge number of children, 1.7 million if I recall correctly, and interesting to see the references of studies evaluating the impact as well, you know, sort of trying to tease out the difference between, you know, that you are making in the communities where you're working. So I've got some reflections that I've already been noting down, and I have some questions that I would like to ask you. But I would also like to remind the viewers and the people who are participating online that you have an opportunity to put your questions into the Q&A box by clicking the question mark that is in the right of your screen. But Patty, my first question is really, obviously at the heart of the JOGG approach is that it is community-based and you're working with communities. You were emphasizing the participatory nature of the JOGG approach as well. Could you tell us a little bit more? I'm sure like listeners are interested to hear about what's your experience working with communities, both positive and negative. What has worked well, what have you found difficult, and how has that sort of informed the evolution of the JOGG approach in the Netherlands?
Thank you. Good question. Actually, what surprised us the most every time is how committed communities are and how committed the municipalities are to make a change. So they see this as their duty, and they see more needs to be done in order to restore the balance in our environment. And I also think they try to make it a mutual responsibility. But here comes also the hardest part, because it's not in every case the case that all parties are convinced that they have a role to play. I will give an example. It's from the municipality of, I think it's Dordrecht. It's a municipality in the Netherlands. And in the Netherlands, we have a tradition. It's a 4-day walk for all school children. And in this week, supermarkets are promoting candy to celebrate the walk, and food trucks make their move along the walking route. So the ball is also in their court. So it takes a village to raise a child, and we are still looking for the magic bullets to get everyone on board. So those kind of organizations are very much needed, and also must be of support to the community to work together on a healthy environment. And not only the community must feel the heavy weight on their shoulders to make it a nice event, for example, for the children. So I think those are the things that surprise us the most.
Yeah, I think it's those are really good examples that you bring, and I think it is really challenging. And you present very nicely in the slides the sort of landscape or ecosystem of actors that need to be involved or part of the journey, or even have to be actors that take action. And I think also one thing that came out of the presentation very nicely was that you're working with them at different levels, right? So you're working with them at the local level, seeing what they will be able to do on a voluntary basis, but you're also not forgetting that there is a role for the municipal government to take in implementing policies, but also the national government. So you've really got the whole covered.
Mm-hmm. Yeah, we are trying to. Yeah.
Yeah. No, I think it's really nice lessons. One thing that also came out, I mean, you said in the studies that were done to evaluate the impact, that actually some of the biggest impact was identified in communities with low socioeconomic status. Could you talk a little bit about how you work with different demographic groups and how you tailor the JOGG approach to the different contexts in which you're working?
Yeah, of course. JOGG is committed to serve all children, first aged 0 to 19, now to 23 years. And as said before, we believe we need to make that difference to reduce the difference. And I think we also have another research conducted by the Mulier Institute, and that shows that 3/4 of children and young people in neighborhoods with a relatively low socioeconomic status live in neighborhoods where the JOGG approach is implemented. And I think that's so, and in even 2 provinces, we reach the 100% of those children. And I think we make it a tailor-made approach in a way that our JOGG teams, they can choose the neighborhoods they want to they want to make the most effort. So you can see that in a municipality X, you have, for example, 8 neighborhoods, and they focus on the 3 neighborhoods with the lowest socioeconomic status. So they start there first, and then they broaden their approach.
Okay, very interesting. And I guess from the landscape of people that you work with, religious organizations, community-based organizations are obvious partners in depending on the context, right? And that's something that we've seen through Cities Changing Diabetes in other contexts, that working with faith-based organizations has been an effective channel to reach different communities.
Yes, it's very important actually to also include the mosque, the churches, and other religious institutions. Yes, yeah, we see this as well in the Netherlands.
Great. Yeah. We have one question coming from Austin, Texas, which is around how are you engaging children and families in local advocacy and local activities. Could you speak a little bit more about the participatory nature and how they can get involved?
Yeah, of course. As I showed you, we have a local team. So we have a JOGG coordinator and a policy advisor, and both form the network. And in the network, you also have school children. You also speak to the children in the sport clubs. Sometimes they build a structure in jongerenraad, in a youth council. So they set up a youth council, and I think that's one of the structures that make it possible for youth to raise their voice into the municipality.
Yeah. Okay, great. One question is also, this is always critical, is how you mentioned the role of policymakers and politicians and keeping it on the agenda. The Netherlands is somewhat lucky, I would say, in that sense. You've got big political support for it. Amsterdam has been a city that is world famous for its approach as well to obesity prevention. So it's on the agenda. But I mean, that's not the case everywhere, right? And I'm just wondering if you have any recommendations for how you, with JOGG and beyond, how you successfully kept it on the agenda of policymakers, key opinion leaders in the Netherlands. Is it working with media? Is it working with political parties? Is it working with, any examples you could give an inspiration to others who are really struggling to get this on the agenda?
Yeah, that's a very good point. It's about communication, and it's about initiating a movement and showing that it works. So the OECD report is very good for us, because then we can show that we really make an impact and what kind of impact that is. And we are now also moving towards the European Union and towards Brussels. And you see that if you come up with this story and people believe in you, so people think we need to have this community-based approach in other countries, not only in the Netherlands.
Yeah. That's great. I mean, and you are lucky to have some of the hard numbers. I mean, the impact slide that you have is very helpful, I imagine. I'm just wondering if also, do you work to tell the stories of communities that, because you mentioned communication, I'm wondering, do you tell the stories of the communities where you're working to just show the sort of change, the lived experience, and how communities benefit from the changes that are put in place? How do you craft that story?
Yes, we do. Yeah. We have a lot of good practices from our 212 municipalities. So we share those stories within municipalities, so that not everyone needs to reinvent the wheel. I don't know if this is an English saying, but not so. Everyone. Yeah. So I think this is something. And we also share this with our national work net, so with other organizations. And I think it's very important to communicate about our movement. So the shift from parents and children are responsible to we are all responsible for a healthy and social environment. So it's not only showing the activities on a local level, but also showing what we are doing with this movement. So I think, yeah, you need to also in communications, you need to communicate at different levels.
Great. And I can see lots of questions coming in, which is good. You've inspired the audience and they're all asking really interesting questions. One is again coming back to the impact, and then another area of question is about scaling the movement. So with regards to sort of capturing the impact and measuring the impact of it, is this something that you at JOGG considered from the beginning? Did you have like a monitoring and evaluation framework established from the beginning at JOGG, or is this something that you developed down the line? And could you speak a little bit about what type of information is being collected by these studies to sort of evaluate the impact?
Yeah, good question. We started with monitoring and evaluation framework. But I have to say it's very hard to measure systems change because that's what we are working on. And it's a very complex and wicked problem we are trying to solve. So in the beginning, we only measured the trends in terms of BMI, in terms of overweight and obesity. But on neighborhood level, for example, this may change every year due to gentrification. So now we also measure other things like changes made in the environment and in behavior. Because after all, a significant change in our environment from unhealthy to healthy is most sustainable. So in practical terms, for example, you can think of, we are now measuring how many schools are working with a healthy school approach, how many neighborhoods are working to make the environment more active for children, or the percentage of children that are drinking sugary drinks less often or exercising more. So we started from BMI and we are now working towards other metrics.
Yeah.
And maybe it's also good to say that multiple research groups are now working on what kind of measures you should use when measuring a holistic community-based approach. So we are waiting for that results as well.
Yeah, that sounds like you've got a very sort of comprehensive approach to looking at what's going on in the communities that you're working in terms of, changes to the environment, changes to the availability and affordability of foods, to opportunities to be physically active. You mentioned that you're working with research partners. Is that something that is sort of also fundamental to the model to have? I think you mentioned the University of Maastricht, right? Is that a partner? Do you have relationship with academic organizations in order to look at the model?
Yeah, we are very close to a lot of different research institutes. We also have here the Wageningen University, the Maastricht University, and we work together with the Mulier Institute also on our own monitoring and evaluation. So on different levels of monitoring and evaluation, we work together with different research institutes because it's very good and valuable also for other countries or organizations to know the lessons learned. Yeah. So yeah, we are very convinced about that.
Great. Now coming to this question about scaling. I mean, I started the Q&A session by sort of saying it's an impressive number of municipalities that you've reached, but that is really a very impressive number. Many successful models even struggle to get beyond one, to demonstrate sort of success in one, and then there's a question about how do we scale, how do we replicate. So I mean, I think one of the major sort of contributions JOGG can make is to say, how do you scale a model like this across the country? And now obviously you have ambition to go beyond, but how does that work on a day-to-day basis? How do you actually build a network that has the capacity to grow?
Good question. Yeah, it is our JOGG approach. So you need to build the networks and you need to build the foundation and shape all the conditions. So the 6 conditions in policy and in practice. So actually, if you grab this framework and you have a very good local team, this framework will help the team to build it on a local level, but it's a very time-consuming business. And I think it's very good to mention again that our national JOGG organizations, we give support on all levels. And I think that's also, it cannot exist without each other. So Yeah, so I think you really need both. So you need a team on a local level and you need a team on a national level that join forces.
Yeah, I think that's an interesting reflection that you're sort of one of your assets is that you do have a national presence, right? That convenes and brings together all the different communities working locally.
Yeah, and also in regions. So also in our provinces or regions. So we also work more and more with regional coordinators. For example, 5 municipalities are working together on the approach. And they join forces as well in setting up, for example, working groups among religious institutes or working groups among schools, etc. So that's something we're discovering now as well. That's very helpful.
Okay, great. Let me just remind participants that they can continue adding questions. Keep them coming. They've been really interesting. One of the things that I think cities or municipalities, even countries looking to replicate the model will be asking is how is this resourced? Where does the money come from? Where do funds come from? How do I get action off the ground? Maybe it differs by different maybe it's different in every municipality, but could you give some examples of how resources come to this initiative? Is it a question of sort of everybody contributing and chipping in, or is there one lead partner, etc.?
Yeah, good question. So on a national level, we are funded by the Ministry of Health, so the local JOGG organization, and the national JOGG organization, and the local organizations are all doing it on another in another way, in another manner. So they need to. Their JOGG team, they need to provide people, so they need to set up a good team. And in this, you have now different, this is maybe also only the situation in the Netherlands, but you have subsidies from the national government for municipalities. It's all very decentralized in the Netherlands. So the municipalities can make use of those subsidies. And they are using those subsidies for the installation of the JOGG teams. It's different in every municipality how they arrange it.
Okay, yeah, that's super helpful. We have a question about the sort of, like you mentioned, 4-day walk being an initiative. People are curious as to what that is, and is it something that is evaluated for impact or success? Is it just a mobilization, or does it actually have an impact?
Now, it's not something we initiated as JOGG. It's a national week, and in this week, all children are walking. So it's not something we initiated because we are not really working on interventions, but we are more working on the system approach. But in the municipalities, you see that they want to make the events that are going on in their municipality, they want to make the events healthy as well. So also sport events, or in this case, a 4-day walk. They call it the Avondvierdaagse, but it's a different organization who organizes this.
Okay. Very good. Can I ask you, this is maybe a little bit of a challenging question that is related, I think you mentioned it in your presentation as well, that sometimes, partners or stakeholders, let's say, not necessarily willing to do what is good for children and what is good for health. It could be a fast food outlet, or it could be a supermarket who is doing unhelpful things in terms of promoting unhealthy food at certain times. Do you have any tips for people who encounter that in their work? How do they overcome that? I mean, of course, one way is working through government and policy, but at the local level, is there any ways in which you've had successful work, to improve the offer of healthy foods around schools, for example?
You need to find the sweet spot. So we have one project working together with food outlets in the neighborhood of schools, and then you see that some having a conversation helps. So some food outlets really want to make a change, but it's not in their core business. So they do not think about healthy children when they are selling food. So I think it's a connection that must be made, and you need to convince them step by step, and you also need to seduce them. Yeah, you need to what's in it for them. You need to make very clear what's in it for them as well. So it's also a sort of business case, but more a moral business case or a social business case you need to present to them. And at JOGG, we are now working on a way to find out how we can introduce such a model, or how we can find the arguments to convince also those kind of organizations to work on our mission, on our goal.
Yeah. No, super interesting. I also read a report that was funded by Impact for Urban Health, which is an organisation working in London with 2 deprived neighbourhoods in London, and they also recognise that the retailers and the food outlets in those areas were not offering healthy options, and so they worked with them to also look through what types of food they could order in that were healthier, and how to position them in the retail outlets, and they've actually found some quite interesting results. So I think that there is, especially working with independent food outlets, for example, and independent food retailers, there's potentially some wiggle room there. So I think that's a super interesting question. You also mentioned that you have future plans, like looking ahead. Where next for JOGG? What is, how do you consolidate your efforts in the Netherlands? What do you think needs to be added and strengthened within the Netherlands? Perhaps we can start there, and then we can come on to international perspectives. But obviously, I guess you want to solidify the work and strengthen the work in the Netherlands. So where next in the Netherlands?
We have 346 municipalities in the Netherlands, so we still we are not there yet. So we are working towards every municipality is a JOGG municipality. So that's one thing. So still growth, but also we want to grow, or we want to be the knowledge partner in the Netherlands, but also maybe internationally. On the holistic approach, so on the system approach, on the community-based approach, on the things we've just presented. So we want to share this knowledge with the world. And this is a thing we want to do in the Netherlands, but also maybe across borders, because this problem does not stop at the border of the Netherlands.
And just to the holistic approach that you mentioned, I mean, one of the things that is most interesting about taking action at the local level through cities, for example, is that you have the ability to take multi-sectoral action, right? I mean, you're not just stuck within the Ministry of Health or the health department. You can also sort of bring in departments with other responsibilities, leisure, you've mentioned, I guess, physical infrastructure for cycle paths and stuff like that. What experience do you have engaging those other sectors? The health sector, for example, should be on board, right? This is their core business, as you to use the term that you mentioned. How do urban planning departments or transportation, do they yet see it as their core business in the Netherlands? Are you closer to it being seen as their core business? And how do you convince them? Because I'm sure in other parts of the world, it's not necessarily the case that they see healthy weight, health promotion as part of their goal.
They see more and more, but still we are not there yet. So still we have to work on also here convincing those parties to work together with us. And maybe one example from the Ministry of Education. now in the Netherlands, we have the ministry thinks it's very good to introduce school meals, because there are a lot of children in the Netherlands who go to school with an empty stomach. They are very hungry, and they are in class and they cannot learn, and so they want to provide school meals. And now we think it should be normal that those school meals are healthy, to give every child, also the most vulnerable children, the healthy start. So now we are negotiating as the health part with the Ministry of Education, and it works out very well, but we still think it should be normal. It should be it should not be a discussion, that also in the Ministry of Education, always health is one of the things they keep in mind when they make a policy or when they come with an idea such as school meals. So I think we still have a way to go, but step by step.
Okay.
Yeah, we are doing our best also on this part.
Super. We have a lot of questions coming in still about the monitoring and evaluation and capturing learnings from the obviously that's something that people give a lot of thought to. Are there any learnings on this for others who are initiating projects about I guess you've got quite impressive results from very rigorous research methodology, I would imagine, from university partners. Do the local municipalities have like a core monitoring and evaluation? Are there core indicators that they have to collect so that you have you're keeping track of what's going on and the type of impact? Is there sort of like a light version and then in-depth research that goes on in parallel?
Yeah, on a municipality level, we provide guidelines, what they could measure, and they provide a fact sheet. But to be honest, I must say I'm not the metrics expert in our team. So if there are questions on this part, I think it's good to send those to us, and we can give an answer to those questions later on.
Yeah, that sounds good. We can distribute some information, or we can put people in touch with you. And so I promised that we would also move on to the question about your sort of international perspectives as well. So, Joe, this type of forum is a great place for you to talk about the experience in the Netherlands. I'm sure we have people joining from many different countries around the world, but you mentioned the European Union as an angle that you're thinking about. How do you see the JOGG experience and the JOGG model being useful to other countries?
It's very interesting for us to think about introducing our JOGG approach also across our borders of the Netherlands. But it's still something that's work in progress. So it's not yet decided how we want to do this, in what way. But what we are trying to do now, it's maybe a step before, but it's we are reaching out to the European Commission and to the European Parliament to make the thought of health in all policies, to make it more clear for them that it's actually very important also on a European level to take health into account in all policy decisions they make. And that will have a result also in the things we want to arrange on national level or on municipality level. So that's the first thing we want to do in the European Union, but we are really thinking what we can do to also make the JOGG approach more scalable, maybe also internationally. But it's not yet decided, so I cannot tell that much about it.
Okay, I won't push you too much. But on the very interesting about the health in all policies, including in the work that the European Union does, do you have any specific examples of where sort of a European Union policy may have an impact on the issues that you're working with as JOGG. I think people will be interested to hear that.
Yeah, you have the Europese dienstenrichtlijn. You have a European guideline on what kind of food outlets are allowed in a street. So, for example, I worked also for the municipality of Amsterdam, and there I saw that due to European guidelines, we could not say, oh, this street is full of unhealthy food outlets. We want to restore the balance. So it would be great if we can, for example, say, let's restore the balance, and it's only still place for 5 outlets, and the one that is now not in, there's no activity yet. We want there not another unhealthy food outlet, but it's not possible, and that's something that's arranged on the European level. So you can think something like this. They can make a change on European level so that other municipalities can make their environment healthier.
That's a super interesting example, and I suppose things like food packaging, food labeling, and marketing may also be issues that cut across the borders within Europe. Well, Patty, I think I've grilled you for enough time and put you on the spot, but I hope everybody's found the Q&A interesting. Certainly, I've learned a lot from the conversation. We will continue to be in touch with JOGG, and as I mentioned before, do feel free to reach out to us if you have further questions that weren't answered, and we can hopefully facilitate that. But I am afraid that our time is up. But before we leave you, I will of course say thank you very much to Patty for your time and effort in preparing for this. But I just want to point to a number of resources that will be available. So first, of course, if you missed a point of 2 of the discussion, or you want to go back and have a listen again, the recording will be available on the Cities Changing Diabetes YouTube channel. So do look at that. And of course, you can look at previous CCD Round episodes as well. As mentioned, there are several ways you can get further support. So you can, of course, contact us directly by reaching out to us at the email address that you see on your screen now, info@citieschangingdiabetes.com, and we'll connect you either to our team or to the team at JOGG. You can also find further information about the work of JOGG at their website, which is jogg.nl. And you'll be able to find a lot of the resources there. And this is also where you can sign up to the e-learning platform that Patty mentioned during her presentation. I want to finally make a pitch for the next CCD round, which is going to take place on the 4th of May, where we'll hear about the development of 3 prevention investment projects. 3 examples coming from Leicester in the UK, Malmö in Sweden, and The Hague. So we have another guest coming from the Netherlands next time to see how they're progressing with those projects. So without further ado, thank you so much again, Patty, for your presentation, and for everybody who joined in the audience, and thanks for the great questions. It was a really stimulating discussion, and have a wonderful rest of your day, afternoon, evening, wherever you are in the world, and we look forward to seeing you again. Thank you.